Jan Rivers, originally from New Zealand, is a former public servant whose roles focused on libraries and information systems. As a lesbian, she is concerned about gender ideology and its impact on young same-sex attracted people. She is passionate about well-run public services and their possibilities for improving people's lives, and suggests that the current approach to gender medicine is an example of regulatory failure. She has taken an in-depth look at the local New Zealand and international guidelines that have determined policy on gender medicine in New Zealand. And she has a lot to say about this. So welcome, Jan Rivers.
Kia ora koutou. I'm like Dyke in from Pornicky, from Wellington this evening. And thank you very much, Janet and Women's Declaration International, for the chance to speak to you tonight. I'm going to be quite dense, I think, and hopefully not go over time. So one of the things that I wanted to do is talk about the quality of transgender research and transgender health guidelines in New Zealand, particularly in New Zealand, although I think a lot of what I say is going to be pertinent to people from all over the world where transgender research is happening. And I'm going to talk a little bit about an upcoming conference and a little bit about GenSpect, which is an organisation that's been around for about 2.5 years now. And I'm going to give you some really brief overviews of some very spectacular, I feel, examples of poor transgender research that's taken place in New Zealand. Then I want to do some commentary on New Zealand's guidelines for transgender health and how also they relate to what are called the WPATH guidelines. So the WPATH is the World Professional Association of Transgender Health. And our guidelines here locally are supposed to be based on the WPATH, the World Professional Association's guidelines. And then I want to speculate a little bit about, so why is it like this? What's actually happening? And maybe do something slightly different from, I think, what most women do when they talk about this. And that comes really from my sort of passion about the public sector. So this is an event that's happening. This is a little bit about GenSpect. So GenSpect was formed in January 2021. It's become a very large organization present in 26 countries. I'm part of a policy group of about 110 people that meet on a special web tool. And we work together, not always amicably, lots of discussion. It's a really good place for keeping up with the news. And GenSpect, because it started as an organization for parents who were skeptical about their children's sudden gender transition, tend to be very capable. And so I think that's really why it's grown so quickly as an organization. One of the things that they're doing at a conference next week in Denver in Colorado is launching a large document called the Gender Framework. So the Gender Framework is a way of looking at what's happening with children when they suddenly announce gender despair or announce that they're transgender. And it's taking it right away from being a medical model to being a much more of a social and psychological model. And as well as looking at the child themselves, it's also looking at that child's family. And I know from being involved with some of the parents of children with gender issues who are being affirmed by everyone in society, no matter what the family knows about the child. I know that the level of distress for parents of transgender children is extremely high. So the Gender Framework looks at that. It also looks at the wider society issues around education and more broadly. The conference, which is going to be happening in Denver next week, is on the 3rd and 4th of November. And that's a big international conference. And GenSpect have decided to follow WPATH. So when WPATH has an international conference, GenSpect will have a conference to match. And then New Zealand is going to be the first place, I think, in the world to launch locally the Gender Framework. So we have an event, a webinar on the 10th of November, and that's going to be very interesting. It has a cost, but if you're interested in coming and you can't afford it, then you can just email the links that are available on this best practice, bit.ly, best practice in gender care, and Janet will be sharing that link later. So the conference has got 2 emeritus professors, a psychiatrist, a doctor, 2 of GenSpect's vice directors, both of whom come from the sort of caring professions, a psychotherapist and a senior Maori emeritus professor who has focused on Maori kind of society, culture, arts, Nahuia Te Awakotuku, who is very well known here in New Zealand. And so my particular piece at that conference is going to be talking about these guidelines in a whole lot of detail, the Patha Guidelines and the problems that I feel that I've identified with them. I'm going to talk now about some examples of bad research in New Zealand. This screenshot is from something called Counting Ourselves, which is the transgender self-organized assessment of the nature of the transgender community within New Zealand. And this is just one very small example from a survey that took 70 minutes to fill in. And what it is a series of questions for people who've retransitioned, which is what Counting Ourselves calls detransitioning. And the thing that I'd like to point out is the reason that Counting Ourselves regards people as detransitioning is almost always because of external pressure, parents who don't approve, pressure from friends, inability to find a job, being pressured by mental health professionals, pressure from your religious community. And very few of them are actually related to internal processes. Now, this is really interesting because the next slide I'm going to show you is a slide from some research which came out in that survey was held in September to November 22. This is some research that came out in April 21, and it was specifically looking at people who detransitioned, and the criteria that people were able to say were the reasons for why they had detransitioned were mostly to do with internal processes. And if you look there, I realized that my gender dysphoria was really related to other issues. So there are 2 main areas why people detransition. One of them is that they kind of come to realize that it doesn't work for them. It isn't making the difference that they hoped it would. Or the second big area is health concerns about the nature of the medicines and the surgery. So quite a difference between these 2 pieces of research. The next one I'd like to mention is a project called the Transgender Pregnancy Project, and that reported at a big reception in Parliament several months ago. And a couple of things to point out about this project was that it was intended to interview between 15 and 20 trans men or women who had been involved in New Zealand's perinatal services. And it was supposed to find these people who had been pregnant over the last 3 years. In the end, they found 11 people, so under the number, and they only found them by extending the time period back for another 3 years. So 11 people who'd been pregnant, 11 women who'd been pregnant within the last 6 years. And to make up the numbers, they interviewed 3 trans women and 6 women who were trying to conceive. And then when the report was written, it was written through the perspective of transgender epistemology. So it was a medical report, but it took on a kind of in a viewpoint perspective of transgender people in order to explain basically what is a medical piece of research. What became clear to me, having read this piece of research, it was called It's Total Erasure, and it was full of really extreme language, like saying that the way that trans identified women experienced their experience with the perinatal services or maternity and other services was one of erasure, or it was one of a eugenic type experience. So quite extreme. And it became clear, if you really look into the research, that if what the researchers wanted to have happened, is that every person who interacts with a maternity service will be asked what gender they are, what pronouns they have. Every person who interacts will be using resources and facilities that are gender neutral. Every person is going to be regarded as potentially transgender. The language will be completely degendered. So this piece of research, which could not even find an adequate number of people to do the research, is going to be potentially driving our maternity services. A little bit of research that was done about the care needs of people in Oranga Tamariki care. Oranga Tamariki is our Ministry of Children. They did some research to find out the needs of LGBTQIA people in care. They outsourced the work to an external organization, two external organizations, in fact, that were mostly led by transgender people. All of the interviewees, bar one, were either transgender or non-binary, despite the fact that there are between 4 times and 10 times as many children in care as those who are same-sex attracted. The advice was almost entirely, therefore, related to the needs of transgender in children and transgender adolescents. And the results of that are going to be binding on care home workers, so that if care home workers or foster parents don't affirm children in their care, if they demonstrate any kind of gender confusion, they will become unemployable by Oranga Tamariki. Yeah, so now this is the sort of main part of what I wanted to say, but I just wanted to really give you an idea about what goes wrong when transgender people's research about them takes place, that it doesn't really have the kind of rigor that is generally expected in science research. And that was my experience of the Patha Guidelines. So it's a document that was released in 2018. It was first released by the Transgender Health Lab at Waikato University. And I took a really good look at it, and I discovered that I had to find out quite a lot about how do you create a health guideline. It's not really obvious. So how do you create a health guideline? Well, there are a series of international organizations like the World Health Organization or the National Institute of Clinical Excellence in the UK or the American National Academies of Science that tell you how to do this. And what I did was I found the common factors across all of those, across 3 health guideline creation standards, and then measured the Patha guideline against those standards. And what I found was that it didn't meet any of the requirements of a clinical guideline. So if you're creating a clinical guideline, what you do first of all is you do a literature review. You find out what there is to know about your topic. And then you work out how to match that research. You kind of work out some guidelines for what's the quality of the research. What do we accept as adequate quality guideline? And then based on that, you use that research in order to determine medical interventions that you might make in order to improve the health of the population that you want to work with. None of that is in this guideline at all. It's totally devoid. It has little more than 100 references, of which only about half are academic references. And it makes a whole series of recommendations which really have no basis in the research which is provided in order to determine that these are the things that you should be doing with children and young people who present with gender dysphoria or gender distress. So, for example, what I discovered, which I think is really important, is the whole issue of social transition. So basically taking a child who protests that they're the other sex and giving them another name, another dress code, another, calling them by the opposite sex pronouns. And what I discovered that there is absolutely no research to support that in the Patha Guidelines. WPATH SOC 7, which is the state standards of care in the international ones around this issue of social transition, say that to socially transition a child is a controversial act. It's not something that you should do. And if you do socially transition a child, you should make absolutely certain that they have a way back. So that's quite shocking. I find that here in New Zealand, we're socially transitioning children in large numbers on the basis of absolutely no evidential proof. There's lots more I could say about the standards of care which were released in 2022. They were created with an ethics chapter, but by the time they came out, the ethics chapter had disappeared. They have a chapter on eunuchs. So basically, what is the care program that you would put in place for a eunuch community? They say that there are no evidence-based surveys for delivering care to children and young people, completely ignoring that by the time they were written last year, there were at least 3 national level surveys demonstrating that the evidence for example, puberty blockers was very poor. And so they somehow managed not to find some of the most important research that's been done in the world on the topic of their topic. I'm freestyling a bit now. I just want to carry on. Why does this all happen? Well, there's the obvious causes like misogyny and the rise of gender ideology following after postmodernism. But I would argue that a lot of our issues around the way that women are losing rights are actually the same reasons that other things are going wrong in our society. So the loss of funding for journalism, the privatization of our public sphere, that academic independence is being lost to fee-paying customers who are regarded as customers and not scholars, that the public service ability to provide free and frank advice has gone, that contractors are used in large amounts in the public sector, and there's a huge loss of institutional knowledge, coupled with the idea that at the moment we've got huge new pressures around climate change, around rapid changing technology and biotechnology, that public sector was really not set up to be able to cater for the kinds of changes that happen month by month and year by year. And finally, what I want to say is that to me, there's a really good piece by Helen Joyce, where she says that so often our public institutions, the form remains, but the function becomes completely subverted. And in the case of gender ideology, the idea of caring for children, the function remains, we have a medical service, but in the case of gender medicine, those children are not being treated, they're being harmed and damaged. Thank you very much. And not quite sure how long I've spoken, but I'm happy to field any questions.
Great. Yeah, thanks very much, Jen. That was really informative.